Hi, my name is Ranie Becker, and I'm a senior student in Trinity Health School of Radiology. I chose the topic of celiac disease because it's relevant to my family. Both my husband and daughter had tested positive for celiac disease with an endoscopic biopsy. My husband had a miserable rash for 10 years prior to his diagnosis. He had dermatitis herpetiformis. Even though celiac is an individual disease, it truly involves the entire family. While an increasing variety of gluten-free foods has helped ease the transition, especially for my daughter, she still struggles with what she cannot eat. Social situations like birthday parties, family gatherings, or even school lunch upset her emotionally. Meal preparation takes time and is quite costly, but it is essential in keeping my family healthy. I'm excited to see what the future of radiology holds in preventing, diagnosing, and treating this elusive disease. Celiac disease is an autoimmune disease that causes damage to the small intestine when a person eats gluten. This damage causes numerous symptoms and can oftentimes be difficult to diagnose. Laboratory tests along with medical imaging can assist in diagnosis. Diagnosis helps to manage symptoms, promote intestinal healing, and creates a sense of overall well-being. While adhering to a gluten-free lifestyle is not easy, it is achievable. So what is celiac disease? It's a serious disease, not a food allergy. It is estimated to affect 1% of people worldwide. The number of ways celiac can affect people, combined with lack of training in medical schools and primary care residency programs, contributes to the poor diagnosis rate in the United States. Currently, it's estimated that 80% of celiac population remains undiagnosed. It is also estimated that there are 2.5 million undiagnosed cases at risk for developing long-term health complications from celiac in America. Accurate diagnosis of celiac disease can be delayed on an average of 6 to 10 years, although that number differs for each person. Celiac disease is an autoimmune disorder, a category of diseases in which the body's immune system reacts and attacks itself. It is characterized by an intolerance of ingesting gluten, a protein found in wheat, barley, rye, and sometimes oats. Eating gluten triggers an immune response in the lining of the small intestine. Over time, this reaction damages the tiny finger-like projections called villi. They aid in the absorption of vitamins, minerals, and other nutrients. Without the villi, malabsorption occurs and may lead to fatigue, weight loss, anemia, bloating, cramping, diarrhea, and other serious complications. Malabsorption in children can also affect their development and growth. Symptoms of celiac disease differ from person to person. Infants and children are most likely to suffer from digestive symptoms such as abdominal pain and bloating, chronic diarrhea, constipation, and vomiting. Children can experience weight loss, fatigue, irritability, or behavioral issues, delayed growth, iron deficiency, or even failure to thrive. Adults are less likely to have other symptoms, but they do have unexplained iron deficiency anemia, bone and joint pain, arthritis, osteoporosis, osteopenia, neuropathies, liver disorders, seizures, migraines, depression, anxiety, fatigue, mouth sores, or a skin rash called dermatitis herpetiformis. Women may have missed menstrual cycles, experience infertility, or have recurrent miscarriages. The cause of celiac disease is hereditary. An individual has a 1 in 10 chance of developing celiac disease if they have a first-degree relative, meaning a parent, child, or sibling with a disease. A person is born with a genetic predisposition. The age of onset can affect all age groups, varying from infancy to the elderly. Disease may be diagnosed during infancy or childhood, or it could lie dormant until triggered later in life. More than 70% of new patients are diagnosed above the age of 20 years, having had the undetected disease since childhood. It is unknown why it becomes active, but experts believe that a traumatic experience, A surgery, a viral infection, or even giving birth may trigger celiac to become active within the predisposed individual. Second-degree relatives and families who have many individuals with celiac also have an increased risk of developing the disease. The prevalence of celiac has increased significantly over the past 50 years due to awareness, thorough screening, and better diagnostic tools. So there are several types of celiac disease, and they have overlapping symptoms. The first being classical or typical. This disease is characterized by common symptoms related to abnormal intestinal absorption. Malabsorption may include diarrhea, statorrhea, weight loss, or failure to grow in children. Symptoms of celiac often occur between 6 to 18 months after babies are introduced to cereal grains. Gluten exposure is essential for the development of celiac disease, yet there is currently no evidence to recommend when gluten should be introduced to children. Another abnormality that may occur in children is an orodental defect. This can happen if celiac disease occurs while children are developing their permanent teeth. It commonly affects the enamel of the incisors and molars. The exact mechanism leading to these defects is unclear. However, immune-mediated damage is suspected. Next is non-classical or atypical. This type is characterized by mild symptoms of the gastrointestinal tract. Symptoms may seem unrelated and may include chronic fatigue, migraines, neuropathy, inability to lose weight, vitamin deficiencies, anemia, infertility, anxiety, depression, dermatitis herpetiformis, abdominal distension, and pain. Atypical celiac may be encountered in older children and adults. It's also more difficult to diagnose because of the varying symptoms. Silent or asymptomatic celiac disease is characterized by being asymptomatic, meaning the patient may not have any clinical symptoms, but the damage to the villi in their small intestine still occurs and causes atrophy. This form of celiac can be found in people with autoimmune diseases, genetic disorders, or a family history of celiac disease. Studies have shown that implementing a strict gluten-free diet in these patients reported a reduction in acid reflux, abdominal bloating, distension, and an overall feeling of better health. Latent celiac disease is characteristic of people with a predisposition for celiac, but have not yet experienced any signs or symptoms of the autoimmune disorder. A diagnosis is made when a serology test is positive, even though there is no indication of celiac disease in the villi of the small intestine. Frequent testing may be necessary to ensure that the disease has not progressed or manifested. Furthermore, it is suggested that the presence of elevated endomysial antibodies is one of the most important predictors of progression. Refractory is a more serious form of celiac disease. It presents itself with malabsorptive symptoms and villus atrophy that remain even after being on a strict gluten-free diet for 1 year. Refractory celiac disease is mostly diagnosed after the age of 50. Roughly 7 to 30% of people continue to have recurring symptoms, laboratory abnormalities, or they simply do not respond to a gluten-free diet, even though they have been gluten-free for 6 to 12 months. These people may be regarded as slow responders because most of them will improve over time if a strict gluten-free diet is maintained. A careful dietary evaluation is also an important step in assessment. Potential is the term used for individuals who have never been diagnosed with celiac disease yet have the appropriate background. They have positive serology or blood testing and have mildly abnormal histology along with a negative biopsy. An individual with potential celiac may be put on a gluten-free diet even though this individual has no symptoms. If left untreated, a majority of these individuals will develop celiac disease. Dermatitis herpetiformis is a dermatological manifestation of celiac disease characterized by chronic, intense itching, bumps, or blistering skin. It is caused by a reaction to gluten. It produces a type of antibody called immunoglobulin A, which travels to the skin and binds with epidermal proteins, causing a rash. This rash is commonly found on the backs of elbows, the front of the knees, the scalp, and the buttocks. It affects only 10% of people with celiac disease. Dermatitis herpetiformis is confirmed by a dermatologist who takes a skin biopsy next to the lesion and tests for the presence of immunoglobulin A. It is rarely diagnosed in childhood, but more commonly diagnosed in one's 30s. Risk factors and conditions most frequently found in patients affected by celiac disease include autoimmune, neurological, or genetic disorders. Type 1 diabetes is one of the most recognized disorders associated and largely seen in children. Type 1 diabetes and celiac are closely related genetically, and those with one disease tend to acquire the other. Approximately 5 to 10% of people affected with type 1 diabetes present celiac disease-related antibodies. Untreated celiac disease can lead to low blood sugar or cause unhealthy blood glucose levels. Autoimmune thyroid disorders such as hyperthyroidism or Graves' disease and hypothyroidism, like Hashimoto's, share genetic risk factors with celiac disease. Abnormal selenium absorption due to celiac disease may be the factor leading to thyroid damage, since the thyroid is sensitive to selenium. Testing for high levels of certain liver disorders, they use enzymes, and they're commonly used in the screening process to diagnose liver disease. It has been reported to affect 40% of adults and 54% of children when initially diagnosed with classical celiac. Prolonged exposure to gluten by a person that does not know they have celiac can cause chronic hepatitis and liver cirrhosis. Non-alcoholic fatty liver disease is becoming increasingly common worldwide, and the non-hepatic cause, such as celiac disease, should be considered in a differential diagnosis of a liver function test. Neurological disorders have been reported to be linked to celiac disease, although the data concerning this remains poor. Epilepsy is the most frequent neurological disorder seen in 1 to 5% of patients with celiac disease. Other long-term complications of celiac in adults diagnosed later in life include iron deficiency anemia, resulting in osteoporosis, T-cell lymphoma, non-Hodgkin's lymphoma, small bowel adenocarcinoma, and reproductive disorders such as decreased fertility in both males and females. Children are less likely to have long-term complications of celiac because the disease is diagnosed and treated early, but they too can have iron deficiency anemia or osteoporosis. Once adhering to a gluten-free diet, their bones can return to normal density. The first step in diagnosing celiac disease may be a serologic or blood test that for accuracy must be done while still ingesting gluten. A diet free of gluten prior to testing may show inconclusive results. Blood testing is performed to check for antibodies common in celiac. Elevated levels of antibody proteins are a good indication of an immune reaction to gluten. A doctor may order further testing, which can include a variety of radiographic imaging choices to help in the diagnosis. An abdominal X-ray may show intestinal blockage that could be causing a variety of symptoms. An upper GI series could be performed to look at the small intestine. Barium coats the lining of the small intestine, making it much more visible, aiding in more detailed imaging, and allowing better visualization. Similarly, a lower GI series helps to visualize the large intestine better. There are certain radiologic findings in any one of these tests that may suggest celiac, such as fewer jejunal folds, increased number of ileal folds, small bowel dilatation, wall thickening, intussusception, lymphadenopathy, vascular changes, or splenic atrophy. Another exam, an upper gastrointestinal endoscopy, is very common and effective test performed to diagnose celiac disease. It's performed by a gastroenterologist while the patient is sedated, and it requires the use of an endoscope. This flexible tube with a camera is used to diagnose symptoms and conditions that may affect the esophagus, stomach, small intestine, or duodenum. The endoscope is placed down the throat of the sedated patient, through the stomach, and into the small intestine to visualize the gastrointestinal tract. During the procedure, small tissue samples, called biopsies, are obtained to determine if the villi have been damaged. This procedure can also aid in identifying cause of other unexplained symptoms or diseases such as heartburn, reflux, ulcers, strictures, blockage, inflammation, or cancer. The use of capsule endoscopy is yet another test that can be used to diagnose celiac disease. This test uses a tiny wireless camera about the size of a vitamin capsule that the patient swallows. The camera takes thousands of colored pictures as it travels through the digestive system and transmits those pictures to video that the physician uses to look for abnormalities in the digestive tract. Once the camera is eliminated through a bowel movement, the test is complete. Results are typically available in several weeks. Computed tomography, or CT, can aid in the diagnosis of celiac. It's commonly performed on the abdomen to visualize disease processes of the small bowel and to assist in diagnosing celiac. Understanding the digestive process is essential for understanding the CT findings in celiac disease. A CT scan will show both the internal and external intestinal wall, thus showing what may be normal or abnormal findings. The CT findings, together with the patient's clinical history, their exam results, and lab findings, should all be used together to help celiac diagnosis. The most common disease of the small bowel is celiac. The only treatment for celiac disease is a lifelong, strict, gluten-free diet, which requires significant patient education, motivation, and follow-up. While starting and maintaining a gluten-free diet isn't easy, it can be done. Fresh fruits, vegetables, potatoes, rice, dairy products, meat, nuts, and other whole food items are naturally gluten-free, assuming they have not been in contact with wheat or other glutens. Gluten-free products are much more common than they were several years ago, and the variety of gluten-free items has greatly increased. There are dietitians and support groups to help you succeed in living a gluten-free lifestyle. A strict gluten-free lifestyle promotes intestinal healing and helps manage symptoms. Celiac patients should be seen by their doctor every 3 to 6 months for the first year after diagnosis. Once symptoms have resolved and blood tests have normalized, an annual follow-up visit is recommended. Early recognition and treatment virtually eliminate the morbidity of celiac disease and the risk of mortality. In conclusion, celiac disease is an immune reaction to gluten. It is found in wheat that is contained in many foods, beverages, vitamins, and cosmetics. For a person with celiac disease, coming in contact with or ingesting gluten damages the small intestine. This damage leads to malabsorption and may cause many other systemic problems. Due to the numerous symptoms that may present with celiac and the variable of onset, finding a diagnosis may be a lengthy and frustrating process. Because the onset of celiac differs in each person, it is essential to be diagnosed early to prevent further damage. There is no cure for celiac disease, but following a strict gluten-free diet is necessary to promote healing of the small intestine and overall health and well-being. And again, I'm excited to see what the future of radiology can do to help diagnose, prevent, and treat this elusive disease. Thank you.